Hey everyone, welcome back to the Npte podcast. This is Will Crane, your host. Thank you so much for joining me as we go through the content you need in order to dominate on test day. So today we've got a practice question. This is related to the neuromuscular and nervous system. So on test day, you can expect a great deal of questions from this, 39 to 48 questions related to the neuromuscular and nervous systems. So clearly a very large system on the exam. In fact, this is the second largest single system on the exam. So definitely one worth spending some time on. So today I've got a practice question for you related to this system, the neuromuscular system, specifically for traumatic brain injuries. But before we get to that, just a quick reminder that we are going full scale, full steam ahead with our VIP course. So every quarter I run a VIP course, and the VIP course is really meant to be a full library of tools to get you across the finish line to finish and pass the Npte. Now, as a part of the VIP course, we have both synchronous content. So I've got some additional sessions we've added this term, as well as our regular weekly sessions that we meet together where we go through practice questions together. So much like what we do here in the podcast, we just ramp that up times 100. We go through lots and lots and lots of practice questions, plus the content behind it and how to answer questions appropriately on test day. That's one of the biggest things that students say after they've taken our class, is that it helps them not only see the content, but also how to reason their way through questions so they can dominate on test day. Additionally, you have access to our full video library. So the full video library includes lots and lots and lots of pre-recorded material on all of the systems, including the other systems and non-systems. These are some of the more plaguey parts of the exam for students, just because there's so much that could be asked, especially if you look at like Goodman's pathology. There's pages and pages and pages, chapters dedicated to these other systems. And I try to summarize that all down to what is most likely to be tested and what you need to know for test day. In addition to all that, you get access to our exam simulator. The exam simulator currently has 6 full practice exams. You can take them as full exams. You can break them up into quizzes. You could break it up just by system areas. You could take a set of 5 questions on neuro, or a set of 10 questions on interventions. Really breaks it all down for you, so you have access to all of not only the questions, but their rationales. Additionally, so it feels like there's so much here. Additionally, you get complimentary access to our crash course. So the crash course is a 3-week accelerated series that we do 3 weeks before every test day. And the goal with that is to help you get through cardiomuscular neuro right before every exam day. So you get a complimentary access to that. In addition to all that, you get to contact and talk with me in power calls. So we are able to schedule one-on-one power calls. Essentially, these are great opportunities to ask questions, talk about study strategy, talk about your experience specifically, so that when you approach your studying, you're able to have some powerful ideas to help you absolutely dominate on test day. So all of that and much more, that's what you get as a part of the VIP class. We are starting that up this week. So if you're listening to this in August, we are starting up right away. We do repeat the class every quarter. So if you're planning on taking the exam down the road, I know a lot of you who are listening to this podcast are either on clinical, just finishing up rotations, whatever it is, you're in your 3rd year of PT school, just sign up about 3 months before every test day. That's when we refresh that VIP class. Always adding more and more content. I think you won't be disappointed. It is fabulous. So be sure to check that out at ptfinalexam.com. All right, let's go ahead and dive into our practice question today. As I said, this is related to the neuromuscular and nervous system. So let's go ahead and cue it up here. I will read to you the question, give you a moment to respond, and then we will talk about it together. All right, when treating patients with moderate to severe traumatic brain injuries, which of the following strategies will be most important to reduce aggressive and combative behavior? So when treating patients with moderate to severe traumatic brain injuries, which of the following strategies will be most important to reduce aggressive and combative behavior? 1, focus on new skills each visit. 2, implement positive reinforcement techniques. 3, practice interventions in an open environment. Or 4, use activities that are less familiar to the patient. All right, so we've got number 1, focus on new skills each visit. 2, implement positive reinforcement techniques. 3, practice interventions in an open environment. And 4, use activities that are less familiar to the patient. All right, so when it comes to treating folks with traumatic brain injuries, there's a huge spectrum of these folks as they are progressing along their stages of recovery. As you consider on the Rancho Los Amigos stages or levels of cognitive functioning, you know that as a patient progresses along those levels, you find that their behavior does change. Now, it is true, though, when they're in their early stages or the more severe stages, you can encounter patients with pretty significant non-compliance, combative, aggressive behavior. This is primarily due to there's a lot of things, but confusion, amnesia, disorientation, all these things are quite possibly factors that bring the patient to become or make them become combative and aggressive. And so you as a PT, you've got to work with these patients and you've got to do so in a positive way. And so that's why the correct answer here is you want to implement positive reinforcement techniques. So what does that mean? Essentially, this is behavioral modification strategies. And what you're trying to do is with positive reinforcement techniques, it means that you're providing positive feedback or giving them some type of nominal reward. Like if you perform this activity, then you get to do this one that's a little bit more fun. Like as PTs, we try to get our patients to eat their vegetables and the dessert. So not just the fun type of activities, but also some of the other activities. And so you find that you help the patient to get a variety of intervention strategies, but it's not that you are totally reinventing how they're doing it. Rather, you're using positive reinforcement. Positive reinforcement, it could just come in the form of compliment and positive mental attitude, a positive response to the patient. In fact, sometimes therapists will use a point or a reward system, meaning, hey, if you get five of XYZ, then you'll get to do this one fun intervention, or you'll get to play with the rebounder machine or whatever it is. Like in our clinic, I remember with, maybe this is the same strategy with teenagers. We would always, we had a laser pointer. It was super fun to use laser pointer type activities. Like you had them do a straight leg raise while you had the laser pointer attached to their foot, like you'd tape it to their shoe. And then they'd have to lift their leg and point it at a target on the ceiling. And it was just the visual reinforcement was so much fun for the patient that they really had a great time doing intervention strategies like that, where intervention activities where there was some type of fun component. And so again, kind of like getting the vegetables down as well as the dessert, you encourage the patient to perform activities that are beneficial to them, obviously all the way along. And then you can implement reward type strategies. You can have this positive reinforcement to help to reinforce positive behavior really positive behavior. These other intervention strategies are ill or poorly advised. So for instance, focusing on new skills each visit, rather, you want to establish a consistent routine. So the patient requires lots and lots of orientation about, who you want to be consistent with the therapist as well. You want the same personality style. You want the same intervention strategies, focusing on consistency. And you'll find that that's a hallmark of all intervention strategies for someone with a traumatic brain injury. Other ones that don't work, you want to practice interventions rather than in an open environment, you'd want to perform it in a closed environment. And what does that mean? An open environment is like the lobby of a hospital. Lots of people coming in and out. You're not quite sure exactly what's going to happen next as far as who's coming through or what the conversation will be. Rather, you want to be in a closed environment, which would be someplace where it's extremely predictable. You know exactly what's going on behind you. There's not a lot of distraction as far as other patients or clients in the room. So that would be a closed environment, like a private treatment suite or a private treatment area where the patient is able to focus specifically on what you're having them do. And finally, the last incorrect answer option here, rather than use activities that are less familiar, you'd want to use interventions that are more familiar or activities that are more familiar to the patient. So this would be things that they have seen before. They know generally what to do or what it is. Again, trying to be as familiar as possible so that they can have as positive of an environment as possible. I know that in the cases where I've treated patients that are somewhat combative and aggressive, these are the things you do. You try to, for instance, when you're asking them questions, you do want to give them flexibility. Say, hey, would you like to walk to the doorway or would you like to walk to the bathroom? Both of them are walking and both of them are good for the patient, rather than walking in and saying, hey, would you like to do therapy today? The answer will always be no. So you try to help them choose things that are good for them. You like to have closed environments, be as predictable as possible, consistency, especially in time and interventions and therapists. You try to be consistent. All of these are strategies that can help when you're treating someone with a moderate to severe traumatic brain injury that is displaying aggressive and combative behavior. So there you go. Back to our correct answer option. The correct answer is to implement positive reinforcement techniques. This would be a type of behavioral modification where you are rewarding good behavior. Sometimes there's a point type system where you say, all right, I want you to let's do these 3 exercises and then we'll do something more fun. That type of intervention strategy can be very helpful to a patient with a traumatic brain injury. All right, so with that, we'll go ahead and bring today to a conclusion. Thanks so much for sticking around and listening to these podcasts. I know that it's a stressful time as you're heading into test day. Let me give you a big thank you. Thank you for what you do. I know that it's important and that you've got lots on your plate right now, but it's going to be not just good for you, but good for your clients as well as you seek to master these concepts to become the very best therapist you can be. If you haven't yet, be sure to leave us a like over on Google Play, Apple iTunes, Spotify, wherever it is you're listening to this podcast. Give us a 5-star review. It helps a ton in the algorithms. And in the meantime, keep a grin on your chin. Keep going. You've got this. Will Crane fist pumps all around, and I will catch you all in the next episode. Thanks, everyone.